We are not politicians. It's our duty to be beyond political issues, if I may say, beyond religious issues. I mean, this is something that we are confronting with, but this should not happen. I mean, we are dealing with the discipline of medicine, where patients are obviously at the center of our world, and we would like all patients to have, what can I say, equal opportunity of being managed. And this is not happening. Let's be very clear, this is not happening. It's not even happening in rich countries or potentially rich countries. I mean, Brazil is one example. I mean, this was one of the BRIC countries upcoming, and now they're facing a serious, let's say, drawback and economic problems. How does this affect? The fact that in many places diagnoses are not done in the right way. It affects you because you're not giving drugs that we would use routinely. But who are the very few lucky countries who so far have managed to survive. But we have to give consideration the median life expectancy is growing, not only in our country but everywhere. So we're living longer. I mean, I'm old enough to remember how we managed patients 40 years ago, 30 years ago. Very different. I mean, now we're transplanting patients who are 70. This would have been unthinkable years ago. So we are treating 80-year-old patients. A 70-year-old today in our countries has a life expectancy of another 20 years because he or she has reached 70. So you can't tell a 75 that he or she is old. No way. They're expected to live another 20 years, so we have to manage them. Drugs are not available. We have hematology leading the way for targeted treatment, revolutionary forms of drugs, oral treatment, very expensive. Who's going to cover all these costs? So these are the big issues. So clearly you have biosimilars coming up, you have generics coming up, which is fine, but not everybody can get them. So it's different to have a good generic or a good biosimilar rather than a homemade product in the backyard. But if in a country where there's no alternative, you'll take the backyard product. So these are challenges we're facing, and I mean, I can see the challenge increasing, not diminishing.